I want to talk about 5 factors that are used in determining whether your teeth can be kept or if it's time to take them out. First one is missing teeth, okay? If you're missing too many teeth, it might just be impossible for us to come up with a good solution for you where we're working around those teeth. The reality is most people show up and they might have 6 teeth remaining, 6 to 8 teeth remaining. And when you get to a point where so many of your teeth are missing that the way your mouth works together is not gonna be there, that is a problem. Because if we keep 6 teeth and replace the other ones, your 6 teeth that you're keeping, they might not have enough protection. In not very long from now, you're gonna start having problems with those 6 teeth. The other key thing to look at is which teeth are missing. Some missing teeth are very easy to replace, and some are very difficult to replace. And sometimes when you are replacing teeth and you're not utilizing something like a dental implant, and so you're looking at bridges or partials, you need to get support from certain teeth. And if those teeth aren't there, then it's not a good option for you. Number 2 would be is that there's too much wear or damage to the teeth that you have. This could be something that has happened slowly over time through grinding your teeth for 20, 30 years. Maybe you did some of the grinding or you had lots of decay, but now it's undermined the tooth structure, things are breaking. Could be trauma, could be you fell and shattered a bunch of teeth. But when you have too much damage or too much tooth structure that's missing, sometimes we cannot use that as a foundation to build on. Number 3 is gonna be too much decay. If you have decay on every single tooth and the levels of the decay are just extreme. I'll give you an example that unfortunately happens more often than you might think. Sometimes people are put on a medication that causes their mouth to be dry. They just keep living their life the same way they've been living it. And then suddenly they're finding out after years of regularly going to the dentist with no problems, they're told you have decay on every single tooth in your mouth, and they're floored. And they're saying, how did this even happen? And it's simply because something changed in the mouth, and then suddenly this problem that was never a problem before has become a huge problem. When there's too much decay, it gets to a point where you're going, what can be done about it? Number 4 is gonna be too much bone loss. Usually people lose bone due to gum disease that has advanced. So, if you have a little bit of gum disease like gingivitis, you're not usually losing bone. But if that gingivitis were to progress to something called periodontitis, where there's actual infection in the gums, that bone loss can get more and more severe. And I like to relate it to a post that's in the ground. If that post is well supported by dirt, it's a solid post, and you can make a fence, you can put a sign on it, all sorts of stuff. But if you start removing the dirt, more of it's above the ground, less and less is below the ground, then you're running into a situation where the stability just isn't there anymore. And then the final one, number 5, is sometimes you might have a very specific goal, and that goal is just not possible with the state of how things are. You might have aesthetic goals, but because of bone loss, because of too many missing teeth for too many years, we can't give you what you're looking for. Or maybe it's a functional thing. You've got your front teeth, but you don't have your back, but now your front teeth are starting to get more damage, more wear, more mobility, and you're wanting to get ahead of it, but because you don't have support in the back, we can't give you that function back because there's not enough bone for it anymore. In the end, what it comes down to is that it is always going to be best to keep your teeth. We see too many people that waited too long and now it's too late. A lot of those people, if they had looked at the problem 5 years earlier, they would not be in a situation where they're losing all of their teeth, and they would have more options. So if you'd like to have those options, go have somebody take a look and have that discussion started. Thanks for watching. We have lots of videos that are all about this type of thing, including dental implants, and we're here to help.